Devin Lyon is live in the newsroom with the latest from OMMA. Devin, you also talked to a different testing lab. This could impact thousands of medical marijuana card holders.
It certainly could, and there has been no recall yet from the OMMA, despite them calling it an immediate health and safety risk. Now, while I was not able to get in touch with Greenleaf just yet, I did speak to another lab that's nearby. They put into perspective for me just how many people this could impact and what local businesses and card holders need to be aware of.
Yeah, the biggest thing to be aware of is with the announcement last night, if dispensaries have a product on their shelf that has a test failed status in the seed to sale tracking system, they need to stop selling that sample or that product immediately. They have to quarantine it, pull it off. They are allowed to retest it.
OKCTO is one of the oldest and largest cannabis testing labs in the state. They're just one of 15 with active licenses in Oklahoma.
We do everything from potency testing, terpene testing, heavy metals, pesticides, microbial, residual solvents.
They spoke to me after recent updates from the state on another large-scale testing lab. It was last Friday when the Oklahoma Medical Marijuana Authority released, quote, inspectors identified a concern at Greenleaf Labs that requires further scrutiny and analysis. Due to the immediate risk to public health and safety, Greenleaf Labs' OMMA license was summarily suspended on an emergency basis. Then on Wednesday, they updated overnight. Approximately 19,000 samples tested by Greenleaf Labs were changed from test passed to test failed status and metric due to erroneous total yeast and mold testing. Greenleaf Labs is one of the largest labs in the state. They work with hundreds of processors and growers who sell to thousands of dispensaries, who then sell those products to medical card holders. OKCTO is not affiliated with Greenleaf, but they were willing to tell me the process ahead and lay out what card holders and businesses need to be aware of.
That is a tremendous amount of samples to be flagged. I would say a very busy lab like ours typically runs anywhere from 100 to 200 samples a day. So 19,000 samples is well over our normal day's workload. So you're talking a month or two worth of work to catch up on that. But also to the dispensaries level, I've heard dispensaries are facing 30% or more of their product being pulled off their shelf. So it's a significant impact for them as well.
Here's what local dispensaries and card holders need to know. Both have rights to the testing status of these products. Both can request a retest, or they can take the product to another lab for testing. Patients can always ask their provider or dispensary for the full test report. Dispensaries can also recheck the status of their products in case the testing status changed, as these products did.
Patient safety is number one priority for our lab and for the state agency, in my opinion. So at the end of the day, if a patient is consuming a product that has mold in it, there are health risks associated with that. So you definitely do not want that to be sold anymore, and there will be further process to notify patients and so on. I assume that they may have consumed a product that was contaminated.
Now, I did just touch base with the Medical Marijuana Authority. They told me they don't have an update yet, but they sent me a link where they are posting these updates publicly. We'll include that on fox23.com and any other updates they have that impact local dispensaries or card holders as they continue this testing analysis. Live in the newsroom covering news that matters, Devin Lyon, Fox 23 News.